Hi guys, welcome back to this channel. We are back as if we never left. Today, we're going to be talking about something quickly. I wouldn't want to take much of your time, but please, if this is your first time here, please do well to subscribe, and don't worry, by God's grace, we'll do well. I promise I'll do, honestly speaking. All right, so today I'm going to be talking about a case I saw here in clinic. I had a case of a 3-weeks-old baby who was brought in by the mother to the clinic with complaints of fever, cough, and difficulty in breathing. So on looking at this girl, I could see that this baby was already in severe respiratory distress. So immediately we commenced oxygen. Then I asked the mother, okay, so mommy, what's wrong with the baby? Tell me what happened. She said, okay, my baby has been having fever and cough for some time now. Then I went to the pharmacy, I collected cough syrup. I gave my baby the cough syrup. The minute I gave my baby the cough syrup, everything just, as if everything became worse. Like, I don't even know what happened. Now, this is where I'm going to be educating you guys. That cough syrup might have been what worsened this baby's situation. Now, how did this happen? Now, I want you to know that there are different types of cough syrups. We have the mucolytic and we have the expectorants. But most of the cough syrups that are available in circulation are mostly expectorants, which is what people don't know. So when they go, they buy this expectorant. Now, how does the expectorant work? The expectorant works by making the mucus to be thickened. And once this mucus becomes thick, with the increased viscosity, it tends to magnate, in quotes, every other debris and all those stuff in the lungs to help clear it up. And then you cough it out. That's thereby giving you relief. That's how expectorants work. Now, but in a newborn baby, more of like this 3-weeks-old baby, these babies don't have the ability to cough out a sputum. So when you give them that expectorant, what happens is that the expectorant does what it's meant to do, which is thickening the mucus. And once it thickens the mucus, this child is unable to cough it out. We listened to this baby's chest and there were so much crepitations. You could feel the wetness in the lungs. Now, this was because of that mucus was so much in the lungs that the child could no longer cough it out and thereby causing difficulty in breathing. So that was what happened with this child. What we did, we had to nebulize the baby severally. With time, the baby made full recovery. But please, my dear parents, we need to stop self-medicating. Every time everybody is using AI, using ChatGPT, Google and all. I'm not saying it's bad to Google your symptoms and educate yourself. But avoid self-medications, especially when it has to do with a little baby, neonates like this. Avoid self-medication. You see, you as an adult, I don't care. You can self-medicate, take anything you want to take. It's your business. But please, you see my little babies, these little angels of mine. Please, I beg you, stop self-medicating. Once there is any fever, please take that child to the hospital. Fever is a sign that something is going on. It might either be an infection or an inflammatory process. So take that child to the hospital so we can find out what exactly is wrong with it and treat the cause. You treating cough has not treated what caused the cough. Yeah. So please avoid self-medication. I hope you enjoyed this video. I hope you learned something from this video. Please, like I said, like, share, subscribe, and don't worry, we are gonna be giving you back to back. See you guys next time. Bye.